presentation is HIPAA compliant. These cases are not real patients, but they are out of my textbook. So similar to what we see in clinic, but not exactly. I'll tell you a little bit about myself, why I specifically chose medicine, and some reasons why I think it's an awesome profession and why you should pursue it as well. We'll go through 5 or 6 case-based shadowing exercises, and then I will share with you my thoughts on what I took away from my shadowing experiences and take some final questions. So I was born in Birmingham, Alabama. You can see I wanted to be a doctor ever since I was a little girl. My dad was a doctor. I majored in biology at the University of Alabama. I then got my MD at the University of Alabama in Birmingham. I did an intern year in internal medicine in Charlotte, North Carolina at Carolinas Medical Center, and I'm currently a dermatology resident at Medical College of Georgia in Augusta. So reasons why I think that you should pursue medicine. If you're a people person, if you're genuinely drawn to people and you want the best for them, I think this might be a reasonable career for you. If by nature you're intellectually curious and inquisitive, this might be a good profession for you. If you like to be challenged and you don't get frustrated, this might be a good profession for you. I would encourage people with a passion for service to others to consider medicine as a career. You have to have a desire for lifelong learning, because here I am at almost 30 years old, finishing my residency, still studying, still having tests every year, so it doesn't stop. And then, you know, you want to be someone that thrives under pressure and is adaptable. I think, you know, that echoes particularly strong this year, given some of the changes we've experienced with the COVID pandemic and how that's affected our training and our clinic operations. So we'll get started with case 1. General medical dermatology is something that I'm interested in. And so this is a patient that we see regularly in clinic. We have a 32-year-old female. She's a smoker and she is overweight. She comes to you and complains of tender, fluctuant, painful draining nodules in her bilateral axilla and groin. She says when they heal, they leave scars behind. The drainage is malodorous, and she's having to change dressings every day in between her work breaks, at home, when she's out with friends, and these lesions are significantly painful for her. As an astute clinician, you diagnose her with hidradenitis suppurativa. It's an inflammatory condition that affects the hair follicles and can cause occlusion with subsequent drainage and scarring. It's a busy clinic, so should you, A, take 10 minutes to sit down with the patient and discuss her diagnosis, modifying factors, and a treatment plan, or B, write a prescription for Humira because you know that's what you want to do and hurry out of the room? I think you all know the answer is A. You should sit down with the patient, explain her diagnosis, talk to her that some modifying factors of this disease we know are smoking cessation and weight loss, in addition to prescribing disease-modifying therapies such as Humira. And so for this case, my biggest takeaway would be that patients with dermatologic disease often wear their symptoms for everyone to see. So in that case, you'll note, you know, she was frequently having to change her dressings, and the malodorous discharge was embarrassing to her, and the pain was affecting her quality of life. So I think it's important to understand what your patients go through, not just the disease that they're diagnosed with. So treat the whole person, not just their disease. Have empathy. I know it seems, you know, duh, but helping patients manage the psychosocial implications of their illness, in addition to treating their clinical symptoms, truly is an art. And when you're in a busy clinic, it can feel easy to be pressed to write the prescription and run out of the room. But I think those 10 minutes do make all the difference. And in fact, there was one study of emergency medicine physicians, and they surveyed patients who spent the exact same amount of time with a physician. So say the physician was in the room for 5 minutes. One group of physicians stood while they talked with the patient and took their history and explained their diagnosis. And then the other group of patients actually sat and got on the same level, eye to eye, made eye contact with the patients. Then they surveyed the patients and said, which doctor did you like better? Which one spent more time with you? Which one did you feel was more empathetic? And even though they spent the exact same amount of time in the room, the patients felt like the physician who sat down, who held their hand, who looked in their eye, who talked to them meaningly and empathetically, was more effective and favored overall. So just something to keep in mind. Next case, dermatologic surgery. So another part of dermatology that I love. It's a lot of fun. We treat a lot of skin cancers. This is a 76-year-old female who comes to your clinic with this lesion on her left temple. She says it's been growing, bleeding, painful over the last 6 months. She's a little bit confused at baseline. She lives at home alone in a rural area of Georgia. She does not drive, and she has limited transportation. So you take a biopsy of this lesion in clinic, and you diagnose her with a basal cell carcinoma. Her diagnosis has been delayed, obviously, because of a lack of transportation, low health literacy, and not access to family who's there to care for her. And now she has this high-risk tumor that's going to require much more complex surgery and potentially local radiation therapy. Again, you're in a busy clinic because every day is busy. Should you call the patient quickly and share her biopsy results? Or should you call the patient, share her biopsy results, and while you're on the phone with her, ask for the number of her healthcare power of attorney or close relative to discuss how you're going to set up transportation to ensure that she gets back to clinic to have the skin cancer treated appropriately? And I think you guys would all say B. So I think the takeaway from this is just at times you're going to be asked to go above and beyond and advocate for your patients. You know, being able to perform the procedure of a biopsy and interpret the dermatopathology results and contact the patient with those results is only a part of your job. I think making sure that your patients are able to access care and undergo the treatment that they need is a huge part of your job. So particularly here in the South, access to care is limited for many reasons, especially in our rural areas, whether it's proximity or difficulty with travel, whether it's insurance coverage or financial obligations. Again, we have a shortage of physicians, and particularly our specialists. There are long wait times to get in. So. And again, health literacy in many parts of the country is low. So being an advocate for your patients is a huge takeaway in ensuring that you follow up on what's best for them. For case 3, we'll talk a little bit about some pediatric dermatology. So this is a 6-year-old child who is referred by his pediatrician. Mom says that since he was about 2 months old, he's had itching, fissuring, and crusting, particularly in his antecubital fossa, popliteal fossa. They've tried numerous topical therapies, topical steroids, topical calcineurin inhibitors. They've changed his detergent, his bath soap. They use a moisturizer every day. You diagnose him with severe eczema. And you want to start a new medication. It's called Dupixent. It's expensive, and it's a biologic medication. So you write the prescription, and insurance immediately rejects the medication. Should you say, I give up, I don't have time to deal with this, write another topical medication in hopes that maybe it'll work this time, or consult your team to collectively present a prior authorization to the insurance company? I think you all would choose B. So this just highlights the importance of working in a team. In medicine, you know, the saying, it takes a village, it truly does. You have to learn to be a team player and have humility to know that you can't do it alone. We work in interdisciplinary teams. So just in our clinic, you know, our front desk staff is fielding patient phone calls, scheduling patients and for upcoming appointments. Our nursing staff is taking vitals as they come in, rooming them, taking their medical history. Our pharmacy staff is helping us with prior authorizations for medications that we think should be prescribed to our patients. And our office manager is behind the scenes coordinating all of this. If you work in an inpatient setting, it's very similar. So in my intern year, when we rounded, we would round with obviously our medical student, our resident, our attending. We would have pharmacy in the ICU at all times. And you're constantly calling your nursing staff, calling the lab to interpret results. So Huge part of being in medicine is being a team player and being humble to ask for help when you need it. In dermatology, I know a lot of people think that we just work 8 to 5 Monday through Friday. That's not true. We do see hospital consults. There are some cases of emergent dermatology issues, some severe drug reactions and things like that that can be life-threatening. So we do stay on call and come into the hospital as needed to see these patients. So for this case, you are called to the hospital to see a 45-year-old male. He tells you that he hasn't been to the doctor in years. He's just not much of one for doctors and needles, and so he stayed away. He's had about a year of unintentional weight loss, and now he notes a new rash, started on the tip of his nose and face. He's got these firm, when you run your finger over them, almost indurated purple to pink papules and plaques. They're spreading down his arms and his trunk as well. And he notes that he's had some blood with bowel movements for the last several weeks. You astutely diagnose him with Kaposi sarcoma. You have 2 other consults to see. You're super busy. So should you, A, recommend further workup of his bloody bowel movements and the cause of his Kaposi sarcoma, or B, call it a win because you knew exactly what this was? The answer is A. You should further work up his bloody bowel movements and the underlying cause of his Kaposi sarcoma. The majority of patients that develop Kaposi sarcoma have an underlying HIV infection. Kaposi sarcoma can also affect the GI tract and could be a cause for his bloody bowel movements. But in a patient with HIV and CD4 counts low enough to develop Kaposi, they could also be at risk of other infectious etiologies like CMV colitis that might cause bloody bowel movements. So being, always inquisitive and always looking to put those puzzle pieces together, I think, are a huge part of medicine, and that's what makes a good clinician. So takeaways from this case are that skin can be a clue to underlying systemic disease. And then I think people who will thrive in a field of medicine are those who have an intellectual curiosity at baseline, who are analytical by nature, and who have the ability to listen and observe more than they speak. And so one study looking at interactions between patients and physicians noted that the physician interrupted within the first minute of interaction between the patient and the physician. So they don't, a lot of times a physician, you have in your mind, I want to know X, Y, and Z. And instead of walking into the room and listening to the patient tell their story, it's so easy to interrupt and say, when did this start? Why are you here? Is it bleeding? Is it painful? So again, I think just reiterating the ability to listen, observe, and a good diagnostician is going to be inquisitive by nature and try to put all the pieces of the puzzle together. Okay, case 5. So I think dermatology is unique because we, along with nephrology, are the only 2 fields of medicine that actually study the pathology of the diseases that we treat in clinic at a microscopic level. So really cool to be able to walk into a patient's room, see their rash, and think in my mind, okay, this is the reaction pattern that I'm going to see under the microscope when I take a biopsy of this rash. And this is why I'm going to treat the rash the way that I am. I see eosinophils on biopsy, so I'm going to do X. So this is a case of a 56-year-old female who presents to you for itchy, violaceous papules on the wrists and ankles. They've been present for several months. They're intensely itchy. They're driving her insane. She hasn't tried anything to treat them, but she comes to you and says, what is this and how can I get relief? So you perform a punch biopsy in clinic of the lesions, and the pathology comes back with a lichenoid inflammation consistent with lichen planus. So takeaways from this case, I think understanding, the science underlying the patients that you're going to be treating in the medicine is so cool to me. I know a lot of times you take these classes and you think, how is this
Dr. Kennedy,
yeah,
you're kind of cutting off. Your mic is cutting in and out. Sorry.
Let's see. Can you hear me now?
Yes, that's much better.
Okay. Do I need to go back at all?
No, I think you're fine. It was just this slide right here.
Okay. So I was just saying, I think understanding the science behind, you know, the diagnoses that you make and the treatment that you choose are very cool, and part of the reason why we go into medicine. I think it's very easy to take classes in college and say, when am I ever going to use this again? You know, why do I need to know the TCA cycle, or, you know, why do I need to know mitosis and meiosis? But you do. It comes up still. I'm in residency and we still talk about it. So understanding the pathogenesis of the diseases that we treat at a biochemical and microscopic level is one of the cool parts of our field. It also helps us target the treatment that we choose. And then, you know, from a research standpoint and investigative standpoint, helps us be inquisitive about how we can develop new treatments and where we should go in the future. To further our fields. And dermatology is particularly exciting because over the last several years, you know, new therapies have kind of exploded, particularly targeted therapies for things like psoriasis and alopecia areata and vitiligo. So exciting things. Okay, so what do we do after work? We get to do all of those cool things during the day: general derm, surgical derm, hospital consults, peds derm, derm path. And then after work, we come home, and it's a very academic profession. So medicine is a profession of lifelong learning. And if it's a career that you're considering pursuing, then you should be ready to read and learn and take tests for the rest of your life. It doesn't stop after the MCAT. It doesn't stop after medical school. I think a huge part of medicine is research, participating in research for a lot of reasons. One, it contributes to your education, and two, it allows us to contribute to the field of medicine and the learning of the medical community as a whole. I think teaching is a huge part of medicine. So here in my residency program, we give resident-led lectures every morning, just working through curriculum for the next 3 years. And then mentorship. That's a huge reason why I'm here with you guys tonight. I think if you talk to any doctor who says they made it where they are without mentorship or guidance, they're wrong, they're lying. That's not true. I don't believe it. And I think it's, you know, our responsibility to pay it forward. I had great mentors. I hope this has been helpful for you all tonight. It's been pretty brief. But again, huge part of medicine is mentorship, teaching, and research. So my final takeaways, I think, you know, this has been quick, obviously, and pre-COVID era, you would have spent a half day or a full day in a physician's clinic and gone home scratching your head saying, you know, what was I supposed to learn from all this? We saw 10 patients with diabetes and 2 with high blood pressure, but like, what? So here are my thoughts on that. I think it's important for you to take away and observe in other physicians that, you know, we do have compassion for our patients and we have empathy for our patients, and we learn to treat them as a person and not just as the diagnosis that labels them. And a lot of times that means more than just writing a prescription medication to treat their condition. It means coordinating their care, or, you know, fighting insurance companies, or sitting down for 2 minutes to understand how this disease has affected their quality of life or their lifestyle. Again, advocacy and service to others is huge. I think advocacy falls under a little bit of the empathy thing, but, you know, advocating that the best outcome and the best treatment for your patient happens regardless, because you're going to get pushback from the insurance companies. There are going to be a lot of roadblocks that want to prevent that from happening, be it transportation, access to care, financial ability to pay for the treatment or the medication or the office visit. Another one is learning to be a team player, and having humility and knowing when to ask questions and when to ask for help. We work in interdisciplinary teams in medicine, and I don't think that's going away anytime soon. So if you are a person that thinks you can do it all on your own and you want the spotlight on you, this is probably not the field for you. In order to be a physician, I think you have to be inquisitive and intellectually curious by nature. You have to want to know more. You have to want to put the pieces together to make that diagnosis. You have to be committed to lifelong learning because, like I said, you'll be studying and reading and recertifying your board exams for the rest of your life. This one's huge. I think commitment to furthering your field and paying it forward, be it through research, teaching, or mentorship. And then you have to have resiliency under pressure and be adaptable. And like I said, that is important now more than ever, given the way the field of medicine is changing in the setting of COVID. And so with that, I'll take any final questions that you have. If you don't want to ask them here, you can message me on my Instagram. I'll be happy to help you there as best I can.
Okay, so we got a bunch of questions toward the end, so I can just start giving them to you and you can start talking about them.
Sure.
If you'd like. So the first one would be, what are some tips you have to help us stand out on our med school application and in interviews? I guess you already kind of talked about the first part on our Instagram, so maybe just in interviews, what do you think would be good?
Yeah, I'm happy to touch on both and repeat for those people that didn't tune in today. So all of this is my personal opinion. I'm not on the review committee, but my thoughts on that are that a lot of people applying to medical school have good grades and they have good board scores and they look good on paper. I think what makes you stand out are your unique experiences. So I think you start by asking yourself, what do I love to do? What am I passionate about? What just really gets my fire going? And then you think to yourself, how can I apply this to medicine, or how can I, harness this to help other people? And I think that's where you really find those experiences that are meaningful, that are unique to you, that make your application stand out. And honestly, they kind of will make you, when you talk about those experiences that are meaningful to you, you're going to light up in an interview, and an interviewer is going to be able to see that, rather than saying, I volunteered doing X, Y, Z that I hated and was miserable at for an hour. You're not going to want to talk about that. So some examples that I have are, I grew up playing chess with my dad as a kid, and I loved the game. So in college, I got involved in a program called Every Move Counts, where we would go to these at-risk schools in our area after school and spend about an hour just teaching elementary and middle school age children to play chess. There's a decent amount of research on how chess can, improve your attention span and your memory and your reading comprehension skills and your ability to think, through problems and problem solving. And so I was kind of able to put something that I loved and enjoyed into a service related aspect of my application. Another example that I gave today on the Instagram is that in college, I was a certified Zumba instructor. And then one of my friends actually started a program called the Diabetes Education Team. Diabetes is rampant in the South, particularly Alabama, and health literacy is low in rural parts of Alabama. And so we would travel to the Black Belt of Alabama, which is kind of more farming community, rural area. They have little access to fresh foods or exercises. There's not a gym down the street. And so we would go and talk to them about diabetes management, about healthy diets. And as a part of that, I would offer, a free exercise class. So I think finding, where what you're passionate about meets kind of your goals and dreams is where you're really going to be successful. Sorry, that was a little long-winded. In terms of interviews, gosh, so whenever I went through interviews, I had both. I had traditional interviews and I had multiple mini interviews. What I can say for both, the biggest thing is to be yourself. When you have the opportunity to talk about your experiences, I hope that you have filled your applications with ones that you enjoy and are meaningful to you. For the multiple mini interviews, I would say spend, the next several months being informed, watching the news. Hopefully you can find a channel these days that's unbiased, and just kind of forming opinions. What I have gathered is they like to see you weigh both sides of an issue. So I was even confronted with things that were, relatively controversial, like teenage pregnancy, abortion, gun violence, things like that. And they just want to see you weigh and consider both sides of the argument thoughtfully.
That's a good point. And the Zumba situation was incredible. I didn't even think of that. So I'm sure that's really good for some people to hear. There are some, do you know when, I think you talked about this, but I think when you knew that you wanted to do dermatology, like at what point in your journey?
Yeah, so I was kind of a late bloomer. I knew I wanted to do medicine from a really young age. Like my dad was a doctor and I thought, wow, his job is so cool. I want to be just like him. I got into medical school, went through my third year and kind of loved everything that I did as I rotated. And so it wasn't until I did a third year elective with dermatology that I really kind of put it all together. For me, dermatology is a perfect field because you get a little bit of medicine, you get a little bit of surgery, you see patients from all walks of life. You're seeing peds, you're seeing adults, you're seeing veterans, you're seeing everyone. And then, also like I talked about earlier, I think it's cool that we have the opportunity to learn the pathology that we treat at a microscopic level that we're also treating in clinic. And then again, I touched on a little bit, how our field is advancing so much with new treatments lately. I just think it's an exciting field to be in.
So there's another question asking, how competitive is it to match into a dermatology residency program?
So pretty competitive. We, as a program, take 3 residents a year, and we get about 700 applications every year for those 3 spots. But I will say good news is that in the past, a lot of those applications may have been filtered by board scores and grades, and all of that in most U.S. medical schools is becoming pass-fail. So step 1 is changing to pass-fail. Even when I was in medical school, like the first 2 years changed to pass-fail. So I think medical schools and admissions committees are starting to realize that the pressure of ranked quartile and test scores doesn't necessarily indicate who's going to be more suited for a position.
That's a very fair point. There's one question that says, how do you learn to know when to push what you advocate for as a physician and when to step back?
Yeah, so I think it's a fine line, right, between patient autonomy and doing what you think is best for the patient. In that situation, I think you have an obligation to discuss all of the options, right? So what you think is the best treatment option, what the alternative option is, and then discuss to them the risk of no treatment, right? Everything that they could potentially experience if you don't have your skin cancer treated. It could locally become aggressive. It could metastasize. It could ultimately lead to death. I think making sure that they're informed and educated, and ultimately the decision is theirs. But I think when they express to you a desire to pursue treatment and external forces are preventing that, I think, going above and beyond and doing what you can to see that through makes you a better physician.
That's a good point. That kind of goes in with knowing to balance between stuff in your interview. So that's a good thing to practice now. How do you deal with stress and emotions, especially as a resident right now?
Yeah, for me, it's exercise. I go to the gym every morning before lecture. That's kind of my 45 minutes of quiet me time. I also like to binge watch some reality TV shows, but those are probably, and my dogs. I have 2 dogs that I walk. So those are my outlets for stress. I think finding a healthy outlet that works for you is what's important. If that's through creative expression, painting, music, walking, yoga, if you want a glass of tea, whatever that is for you.
Yeah, that's good for sure. There's another one that says, do you do volunteering or services in healthcare alongside working, in residency right now, or are there any meaningful and insightful experience? experiences that you've dealt with the past few years in particular?
Yeah, so a couple of things obviously have changed since COVID. In medical school, we had a student-run free clinic that was called Equal Access Birmingham, and third and fourth year medical students were allowed to volunteer to see patients. We had a dispensary in the clinic full of like donated medications from pharmaceutical companies. So we're able to provide free care to those without insurance and without the financial means to have that care otherwise. Similarly, there is, I think it's one Wednesday night a month here in Augusta, a Latina clinic that they ask us to volunteer at for dermatology. Obviously, that's been on hold with COVID. So we haven't done that recently. But I think, you know, in the field of medicine, you know, you get into medical school, you're obviously blessed to have an awesome career and do something that you love. And I think that you have an obligation to use that for good and to pay it forward.
Absolutely. I guess kind of going off of that, do you feel like you see a diverse patient population in your clinic right now? And do you feel like you're taught enough in medical school and or residency about skin diseases and conditions presenting on darker skin tones?
Yeah, I do. I think maybe it's variable by region and where you train, but specifically in my residency program, we do see a lot of skin of color. We, you know, our program director does a great job of making sure that we in lecture have an example of eczema looks like this in white skin and eczema looks like this in skin of color, because erythema is subtle in darker skin. It might look more purple or violaceous than it does in, you know, light skin. So I feel personally that I have had those experiences and I appreciate them. I know, you know, our field recently has been under fire for having a little bit of bias in some of our publications, and people feel like skin of color is not well represented. I think that's unfortunate. I hope that everywhere, you know, picks up to meet those obligations of training. But yeah, I feel blessed that my program, we do have access to that.
Yeah, that's awesome. It's really important right now. What are some ways to help with health literacy?
Yeah, that's a hard one. So I think you're not going to quickly in one setting change someone's level of education. So if they didn't finish high school because they had to work on their parents' farm and education wasn't a priority in their family, that's not going to change overnight. But I think taking the time to break it down. So, you know, maybe you understand in more complex terms what it takes to manage diabetes and to eat a healthy diet and to exercise, and being able to break that down. You know, you hear A1C and a light bulb goes off, but someone else may say, what does that number mean? And what does preprandial and postprandial glucose mean? Why is my doctor telling me that my preprandial glucose should be 80 and my postprandial should be below 120? So I think breaking those things down into simpler terms is a way to help improve health literacy and help your patients have understanding of their diagnoses and how to manage them.
There's another question that says, when it comes to invasive surgeries in dermatology, are there any other specialties that you have to consult with for those surgeries?
Yeah, all the time. So a lot of our surgeries we do not do under anesthesia. We do, obviously, Mohs micrographic surgery is, you know, skin sparing surgery for skin cancers. We remove cysts and things like that. But if a skin cancer is large, like the one we saw in that lady's temple, and near high risk structures like the eye, the ear, you know, things like that, oftentimes we will consult with oculoplastics or ENT, head and neck surgery, or facial plastic surgery to reconstruct those wounds. And those a lot of times will be done in the operating room under general anesthesia.
So there's one that says, do you have any opinions and or advice for people who are considering pursuing an MD, PhD path to dermopathology?
Yeah, I think that's a great path. I think I admire your desire to do it. It's a long road. I think the hardest part will be, you complete that first 2 years of medical school, and those friends that you've made along the way will move on and they'll complete their MD and they'll graduate, and you'll still be there for 3 or 4 more years finishing your PhD. But in the end, I think that it's worth it. And I think that you should certainly, pursue what you're passionate about and what your dreams are.
Yeah, for sure. So with the pass fail for step 1, what are some other ways that you think medical students can stand out for residency, especially for dermatology?
Yeah, I think again, it goes back to meaningful experiences and things that, you care about and that you can speak to and that you're excited about. So, when I was in medical school, I was a representative on student government and just tried to find a way to be involved in activities that I found exciting. And I talked a little bit about Equal Access Birmingham and volunteering through that. We actually set up a dermatology clinic. So Equal Access Birmingham primarily did, primary care or internal medicine, but we did set up once a year a dermatology clinic for skin diseases, and volunteered at that clinic as well. So I think finding opportunities, like I said, to mix your passions. So if you're passionate about dermatology, finding a way to blend that with your volunteer opportunities, with your leadership opportunities, would be important.
For sure. Do you have any advice for people pursuing a DO path for dermatology?
Yeah, so a lot of DO programs now, there are DO specific dermatology residencies, there are MD dermatology residencies, but I think a lot of them are blending these days. And in fact, I think it's a lot more accessible these days. So I would say go for it. I mean, I think it's an awesome career, and I'm obviously biased, but I love it and I want everyone to do it. So
I guess kind of challenging that, if you had a chance to choose again, would you still choose derm?
Oh, absolutely. 100 times over.
Was there any other specialties that you felt could have caught your eye?
Yeah, I loved OBGYN because it's pretty similar to derm in that on the gyne side of things, you practice medicine, right? You're responsible for a woman's healthcare maintenance, annual vaccinations, cancer screenings, things like that. And on the OB side, you're doing more procedures, right? Labor and delivery, C-sections, deliveries. It's a little bit more hands-on. It's a little bit more of a isolated patient population. Obviously, you're seeing women only, and you're not really seeing children unless you do peds OBGYN. So I kind of liked the diversity of dermatology a little more, and then obviously you get less of the path with OBGYN, but I liked it a lot.
So do you ever feel like you were treated differently because you're a woman? And if there were any difficulties, how would you handle those experiences?
Yeah, I think the answer to that question is yes, every day. In fact, last week, it's particularly bad at the VA for some reason with our veteran patients, but I was doing a surgery last week with one of my male colleagues. The patient comes into the room and says, "Oh, are you my nurse today?" And I said, "No, sir, I'm your doctor. Let's get started." So we start the procedure, and my colleague leaves the room, and he says, "Where did the man go?" And I said, "He left. So I'm still here, though, Dr. Kennedy, doing your surgery." I think my response to it has been, you just have to have thick skin, right? Like, you worked really hard to get here. You know what your accomplishments are, and you don't owe it to anybody to prove yourself. You're educated and you're smart and you're successful. And I think just letting those comments roll off your back and having, an appropriate but quick response, "No, sir, I'm your doctor," is has been my way of handling it. I don't think that you're going to change the way people necessarily have been when they're 80-year-old men calling you honey, sweetie, dear, but you can certainly try.
Yeah, it's fun. So would writing about skin conditions, educating about the importance of SPF and advancements in literature be a good way of expressing one's passion for patient advocacy / education and interest in cosmetic science? Do you think that would be beneficial?
Yeah, definitely. And one thing that I was informed about recently, so we had a journal club at work where we read an article on the state of sunscreen and SPF in the US. And I was actually shocked to learn that a lot of UVA blockers are not approved by the FDA. So our sunscreens here that say broad spectrum only list an SPF. And so SPF is just a measure of how protective a sunscreen is from UVB. UVB causes burns and skin cancers, but UVA causes photoaging and is a risk for melanoma. And in the US, we have really poor UVA blockers. They're really photolabile. And so when a sunscreen says broad spectrum, it doesn't necessarily mean that it has great UVA coverage. And we don't even have a rating scale for UVA coverage on our sunscreens. You know, like in Korea or other places, it's required that they put a PA rating on a scale of plus to 4+ to say how UVA protective a sunscreen is. So I do think that's interesting to educate people, because if you wear a sunscreen with SPF, you'll never burn because UVB is responsible for burning. You're protected from UVB, but you're still getting cumulative photoaging and harmful effects of UVA. So I think definitely educating people about that fact and then pushing for, you know, the FDA to approve more broad spectrum UVA blockers is huge, because I'm currently having to order my sunscreen from a Korean beauty company. So would love if it was more accessible here.
I think the next question kind of goes off of that. There's, so someone asked, are there any skincare products that are affordable that you recommend for college students? And what sunscreen do you use?
Yeah. So I post a little bit about this on my Instagram. If you're talking specifically just about like keeping healthy, youthful skin, I think there are 3 things you can do. One is sunscreen, obviously. Sunscreen, sunscreen, sunscreen till the sun goes down all day long. I've been ordering one by Purito off of Stylevana. It's a Korean beauty skincare company for all of the reasons that I just long-windedly told you. I was looking for something with good UVA and UVB broad spectrum protection. If you choose something with zinc and titanium in it, it also protects from UVA. So as long as you pick a mineral blocker, that should be fine. And then a retinoid, a topical retinoid, just kind of helps increase collagen production in your skin and increase cell turnover, which is helpful in preventing photoaging and acne and things like that. So Differin Gel, it used to be available by prescription only. It's now available over the counter. It's the only topical retinoid that's available over the counter without a prescription. I would say, you know, that's another thing that I would recommend, just a pea-sized amount to your entire face at bedtime. Most people are going to peel and be flaky for the first 6 to 8 weeks, but that will subside with time. And then if you struggle with things like hyperpigmentation or melasma or sunspots, God forbid you didn't wear your sunscreen, then vitamin C is a good choice. And I don't know if any of y'all have seen the Ordinary brand. I think it's gotten pretty popular recently, but they make some good vitamin C serums that are affordable. And you just want one where the first ingredient isn't water because vitamin C is not stable in water. So you want a serum that doesn't have a lot of water in it.
Yeah, there are some people in the chat saying they love the Ordinary, and I do
Yes,
as well.
I do too. It's awesome.
There's a question asking, what kind of ingredients do you recommend not putting on your skin?
So harsh scrubs, like, you know, harsh exfoliating scrubs, I think are kind of a thing of the past. Not a big fan of like pore strips or pore vacuums. Those can be traumatizing. And the best thing that you can do to minimize pores is use that topical retinoid, the Differin Gel, like I talked about. You know, some people, I guess, would put like lemons or limes in a homemade facial mask. I wouldn't do that. There's a risk of phytophotodermatitis with citrus fruits and sunscreen, and sun reaction. You can get a phototoxic reaction to that. So I would avoid that. And then if you struggle with acne or you're acne prone, I would specifically look for products that say non-comedogenic on the label. That means they won't form acne bumps. So those are probably 4 of the big ones that I would say stay away from.
Thank you. This is you kind of answered this on our Instagram, and you said that you weren't a non-traditional student, but could you potentially answer kind of like if you had any friends or if you knew people like your classmates that went through that experience, or what would you recommend for non-traditional students?
I assume that non-traditional means not straight through from like undergrad to med school or med school to residency, correct?
Yes, and then this particular person said they have a family and career changes, so that's just an added factor.
Yeah, I think a lot of times applicants like get stressed about that and view it as a hindrance or a negative factor on their application. And I actually think it's awesome. I think it is a positive attribute to applications committees because that gives you time. Like I said, you know, the experiences that you have in that time off are unique to you. It shapes you to be who you are. It allows you to mature and, you know, grow in that time. And I think that applications committees view that as very valuable. And so I think the most important part of your application is being able to speak to what you did in that time and what your experiences were and how they led you to a career of medicine and how they're going to benefit you going forward. But yes, I definitely had people in my medical school class and even some of my co-residents who took a year off here or there for one reason or the other, or had different jobs before coming to medicine. One of our former residents was a chemical engineer before she went back to decided she wanted to pursue medicine. So it can be done. And in fact, I view it as a positive.
Thank you. This one is an interesting question they asked. Do you ever recommend any type of sun lamp therapy for those who can't absorb vitamin D vitamins in the winter?
So we do not recommend light therapy for vitamin D. We recommend oral vitamin D supplementation, but we do use narrow band like UVB or even sometimes UVA to treat certain skin conditions like psoriasis or cutaneous T-cell lymphoma or vitiligo. So we do sometimes use a light box as treatment. But our recommendation for vitamin D deficiency would ultimately be oral supplementation.
I think this is probably the last question. There's a lot, so we probably skipped over some, but
yeah, and definitely people can reach out to me on Instagram. I'm happy to answer questions as best I can.
So this question asks, what products are good to minimize large pores on the face, or just any recommendations you have for large pores?
So I will say it's not the size of your pores, but it's the cell turnover that gets built up in those pores that gives you the appearance of having blackheads or open comedones. The best thing you can do for that, like I said, is a topical retinoid. So the one that I like is Differin Gel or Adapalene 0.1%. It's available over the counter. It used to be prescription strength. And what that does is normals your keratinization over time. And clears out those pores so that they start to look smaller in appearance.
Thank you. And I think that's it for tonight. There's so many comments about how awesome you were and they loved your takeaways. There's people saying that they would definitely go to you to be their dermatologist.
Great.
And everyone just loved your session.
Good. Awesome. Thank you guys for having me. Enjoyed it.
Thank you so much for doing this for us.
Of course.
Thank you so much.